My name is Dr. Robert Udelsman. I am the Chief of Endocrine Surgery and Director of the Endocrine Neoplasia Institute at Miami Cancer Institute. Research is a constant. Everything we practice is based upon the studies done before us. We synthesize all of this information and make decisions about how to manage patients. We're always looking for new techniques and innovative techniques to minimize approaches to tumors, or to make surgery more effective, or to work with our endocrinology colleagues. So research is imperative. There's two things to consider for every patient. It's quantity and it's quality. If the quantity is extended, but the quality is torture, you've done no favor to anybody. But I know at the end, most people want to survive, but they want to survive with dignity, and they want to be able to communicate with their loved ones. The first misconception that the public has is that cancer is one disease. It's not one disease. It's hundreds of diseases, and they're all different. And that's what's great about the Miami Cancer Institute. There are specialties in every one of those areas with people who, just like me, are obsessed with the diseases and the organs that they take care of. One particular patient who I'm fond of, she's a world-class athlete with an advanced thyroid cancer, and they did an operation in California and were unable to remove all of her cancer. So we set her up, we did the operation. The operation was long, tedious, but it went well. I resected a massive amount of disease, and that was about 10 years ago. And she continues to follow me. In fact, she's transferred her care down here to the Miami Cancer Institute. She's the kind of patient that will follow me for the rest of my career. She'll probably outlive me with her disease, and that's a good thing.